Good afternoon. I'm glad you joined me here at Abundant Health and Wellness for our regular Friday Lunch and Learn. And today we're going to be talking about protein pump inhibitors. Now, a protein pump inhibitor is a pill that you will take if you have indigestion, and they are very easy to get. They've been on the market for a long time. They're only approved by the FDA for short-term use, and yet we see commercials all the time for people who are doing them long-term. And the commercials will say you can eat whatever you want to eat. You just take this little pill, and some of the little pills work instantly. Some of the little pills work in 24 hours. And so it's like all over the place, these protein pump inhibitors. Now, what is a protein pump inhibitor? A protein pump inhibitor is a drug that tells your stomach to quit producing acid. So I'm going to give you just a little bit of a biology lesson. When you eat your food, you masticate your food in your mouth. Your saliva has enzymes and chemicals in it that help break down the food. Goes through the esophagus into the stomach. In the stomach, you have hydrochloric acid that breaks down the food. It passes from the stomach into the small intestine, and in the small intestine is where all of your nutrients are absorbed. Okay, if you don't have hydrochloric acid in your stomach to break down the food, you're not going to be able to absorb your nutrients because your food particles are going to be too big. Maybe some of you have had the experience of going to the bathroom and you can see undigested food in the toilet. Okay, so what that means is that you have not digested your food. If you don't digest your food, then your food is not going to be broken down so that your body can absorb the nutrients. So it's very, very important that you have hydrochloric acid in your stomach. Now, the stomach is built for that. You have a protective coating inside your stomach that protects the flesh of your stomach from the hydrochloric acid. Now, people that have stress and H. pylori bacteria and maybe some other kind of toxicity, they can get what is an ulcer, and what that means is that the mucus lining in the GI tract has been burned away. Sometimes that happens with a fungal infection, and the hydrochloric acid actually meets the stomach wall and it irritates it and it eats it up, and so that's why you have an ulcer. We don't want you to have an ulcer. That's not what we want. But we also don't want you taking something that's going to stop your stomach from producing acid. Now, the acid in your stomach not only breaks down your food, but it also kills viruses, parasites, and bacteria. So you need hydrochloric acid in your stomach in order for you to function the way you're supposed to function. I mean, God is really smart, and that is the only organ in the body that makes hydrochloric acid. Hydrochloric acid is pretty strong. That's why when you vomit, you'll burn your throat. Okay, it's because of that hydrochloric acid. So we know that the medical profession will give you a protein pump inhibitor if you have indigestion. Why do they do that? They do that because they do not want that hydrochloric acid coming back up into the esophagus and burning the esophagus. So I'm going to give you just another little bit of an anatomy lesson so that you kind of can get some understanding here. So you eat your food, it goes down. Right under the heart is where your stomach is. And so the esophagus comes down and it kind of bends right under your left breast and attaches to the stomach right there. So that is called the cardiac sphincter. When the cardiac sphincter, and think of a sphincter as a rubber band, it closes off the opening to the stomach from the esophagus. When you are overweight and you sit down, you've got this big belly, you sit down and all that fat pushes everything up. Well, what that does is it pushes that stomach back up through that sphincter, and that's what's called a hiatal hernia. When that stomach comes up through the sphincter, that hydrochloric acid breaches that barrier, gets in the esophagus, and it causes lesions in the esophagus. The doctors will diagnose it as Barrett's esophagus, which is a precancerous condition. So we don't want you to have that. So it's really important to get the indigestion under control. So what I'm trying to say is it may not be that your body is producing too much acid. It may be that you have a hiatal hernia, which that sphincter is expanded to allow the contents of your stomach to come back up into the esophagus. And so that could be the cause of it. And so they will give you a protein pump inhibitor, not fix the hiatal hernia, but they'll give you a protein pump inhibitor to stop the acid. So when you do have that regurgitation, it's not going to burn the esophagus. Short term, that might be an answer. But the real answer is to get the hiatal hernia fixed. Now, there are some mechanical things that you can do. You can go to your chiropractor and they can pull it down. I was trained to know how to do that in my studies, but I haven't ever done it. And so don't ask me to do it because I probably don't remember. But I know that it can be, if it's not too bad, that you can just take your fingers and you can pull down that sphincter and it'll snap back shut underneath the esophagus. So that's something that you can do. Your chiropractor can do it. Your craniosacral therapist can do it. A lot of different people can do it. One of the things you can do is you can lose weight, and then when you sit down, it won't push everything up. So that'll solve the problem too. There's another way that you can have indigestion, and that is you make too little stomach acid. So actually, the symptoms of indigestion could mean you have too much stomach acid, but it could also mean that you don't make enough stomach acid, especially if you're over the age of 50. And so you can look at it, you can Google it, you can PubMed it. It's out there, that information. A lot of people go to I've got acid indigestion, I feel this burning, therefore I must have too much acid. Not necessarily. You may have too little acid. And so another thing that you can do, and this is what we do in the clinic, we've got several different products here. We've got hydrochloric Ease, we've got betaine plus, and we've got high HPF, I can't remember what that stands for, but it also helps you increase your stomach acid. And we find in the clinic that a lot of times when people come in with acid indigestion and they're wanting something natural, we put them on one of these products and all of a sudden they don't have any problem with indigestion anymore. And that just proves that they didn't have over acid to begin with. They had under acid, but it had the same symptoms. And so they really did themselves a favor by not getting on the protein pump inhibitor. Now I want to talk to you a little bit about these protein pump inhibitors and to let you know why they're so dangerous. Number one, I want to let me back up a little bit. The body's really, really smart. The brain is mission control. And so if you take a protein pump inhibitor, your brain is going to ask the stomach, why are you not producing acid? And the stomach's going to go, I don't know, they're giving me this medicine and it's shutting me down. The brain, because the brain knows that you need hydrochloric acid to digest your food, the brain is actually going to tell the stomach to produce even more acid. So you get to the point of diminishing returns, and we don't want that to happen for you. And so it's really, really important that if this is a problem that you have, you might want to look at addressing the situation of maybe you have not enough hydrochloric acid, and that's why you're having these kind of symptoms. As I said earlier, people like these protein pump inhibitors because then they can eat what they want and they don't have any kind of digestive complaints. But that's really not the smart thing to do. If you're eating something that's causing you to have indigestion, don't eat it. That's your body telling you in some cases that this is something that's not good for you. So, the guy in this article, this was an article that was taken from a website called Green Med Info LLC, and they're really, really good. They're really sound. I like what they say, but they took this article and they reprinted it with permission, and so I'm going to give you just some little highlights there. Okay, so Cook, which is a doctor, he likens the process of taking protein pump inhibitors to a garbage disposal that requires acid to work. The cells rapidly become burdened by these waste products, and the damaging effects of the aging are accelerated. This type of cellular damage leaves patients, particularly those taking PPIs for a year or more, susceptible to a host of diseases and even premature death. Okay, anytime something says premature death, I'm really going to look at that because I am just not in the market for premature death, okay? So, what are the different things that you can expect if you take these protein pump inhibitors? Well, the first thing is increased risk of kidney damage, and we see a lot of kidney damage here in the clinic. We have people that come in with stage 4 kidney disease, kidney dysfunction, and we really have a good history of being able to turn that around. So if that's something that you are dealing with, we can definitely help with that. So it says there is evidence that the PPIs are damaging to the spleen. Now, your spleen is your immune system, okay? So you don't want something damaging your immune system. Now, I'm just going to give you kind of a hint as we go through this on the PPIs. You think it's only just attacking the stomach acid, but really it attacks the whole body. So I'm going to show you why in a minute. It says, it says evidence that the PPIs are damaging to the spleen and the kidneys. It first appeared in case reports of acute interstitial nephritis, which is inflammation of the tissues between the renal tubules that affect how our kidneys regulate and uptake water. This condition, which can lead to kidney failure, was observed to occur suddenly and significantly in higher rates among users of PPIs. So it doesn't take very long on a PPI to go into kidney damage. It damages your kidneys. If your kidneys quit functioning, you're going to have to be on dialysis and you're going to have a transplant. We don't want that to happen. Cessation of the use of PPIs initiated a reversal of symptoms in many cases. Once the alarm was sounded, large observational studies were conducted that found correlations of PPI use with increased incidence of acute kidney injury, chronic kidney disease, and end-stage renal failure, okay? These risks increased when users consume more than one dose of these medications per day. Okay, so this is really, really important. Nobody wants to go into end-stage renal failure. Nobody wants that. Don't do it. Just say no. You don't have to go that way. Okay? There was an increased risk of heart disease. There is now significant evidence of adverse cardiovascular effects from PPIs. In June 2016, an article published in the American Journal of Cardiovascular Drugs reviewed the available information on cardiovascular risks from PPI, as well as how this harm occurs. The study confirmed that protein pump inhibitor effects are not isolated to stomach cells. Okay, PPIs were observed to reduce the acidification of lysosome cells responsible for the breakdown of protein, fats, carbohydrates, and nucleic acids. PPIs alter the basic cellular functions, including those related to blood clotting, thereby increasing the risk of major adverse cardiac events. Okay? A study in Denmark involving more than 56,000 patients who had been hospitalized for myocardial infarction reported a 30% increase in the incidence of cardiovascular death, reoccurring myocardial infection, or stroke within the first month after discharge if they took PPIs. That's significant, okay? That's really, really important. So if you do, and I hope you don't, but if you do go into the hospital with heart issues and they ask you if you are taking a PPI and they tell you to quit taking it or to be careful with taking it, I hope you listen to that because we don't want you having a 30% increase of further cardiovascular events. In another study, nearly 24,000 participants confirmed this finding reporting an increased risk of recurrent myocardial infarctions in individuals taking PPIs. The meta-analysis of studies involving more than 100,000 patients in total examined the link between cardiovascular risk for patients taking PPIs in conjunction with taking blood thinning drugs, one particular clotrimazole, and I may not even have said that right. Analysis revealed that while this drug combination is known to be avoided due to PPIs diminishing the effects of the blood thinner, a significant cardiovascular risk was attributable to taking the PPIs alone. So you don't want to increase your risk of a heart attack, right? We don't want to do that, so you need to be real careful with your PPIs. So the third reason that you don't want to do this is because it gives you digestive dysfunction. Well, why? Because you don't have enough hydrochloric acid to actually break down the food so the food can be utilized. It says most people take PPIs because of a stomach upset, so it may seem oxymoronic to include this condition in the list of reasons not to take PPIs. The most common ailment cited when writing prescriptions for PPI is gastroesophageal reflux disease. We call it GERD, G-E-R-D, okay, which expresses an excess acid in the stomach. But a PPI prescription is also written for 50% of all digestive diseases, okay? PPI overuse has been documented in numerous studies. So whether the cause of the digestive complaint is excess acid or something else, a protein pump inhibitor is often prescribed. This makes proper diagnosis of the digestive complaint impossible, as the domino effect of symptoms that may or may not be related to the original problem can cloud the picture. And we see that all the time with medication. It says the gut is believed to be our second brain, and we definitely believe that. We have protocols here in the clinic that clean up the gut. It cleans up the microbiome in the stomach, the small intestine, and when we do that, we see just a host of other complaints just go away. And so that's something that's really, really important. If you come in with a lot of different things, but you've got some gastro complaints, we definitely are going to put you on that protocol because we have just seen it do miracles. It's just amazing what it will do. And so I definitely believe that there is a gut-brain connection. I also think that there is a gut-heart connection. And when your microbiome in your stomach is not right, everything in your body can go wrong. And this kind of, the study confirms that. And so I want you to understand that. It says the acid basis in the stomach directly altered by the PPI is now understood to play a vital role in the health of the all-important microbiome. The PPIs alter the delicate pH balance in the gut, compromising microbiotic communication and corrupting these signals. So we don't want to see that, okay? Studies have linked PPI use to damaged health and diversity of beneficial gut microbes. So if you don't have the beneficial gut microbes, what are you going to have? You're going to have H. pylori disease. You're going to have ulcers. Something called SIBO, small intestinal bacterial overgrowth. Why is that? Because you have messed up the pH of the stomach with the PPI, and when the pH is messed up, then you're going to have creatures that grow in the stomach that are not supposed to be there. And those are really like molds and funguses. We don't want to have those in there because that causes all kinds of digestive disorders. It says a compromised microbiome can drive digestive complaints and commonly reported PPI side effects such as diarrhea and vomiting. Having an impaired microbiome for months or years can lead to serious disease such as inflammatory bowel disease, obesity, diabetes, liver disease, cancer, and more. So when you are messing up your pH of your gut, you are opening up yourself to cancer. We don't want to do that. The fourth thing on the list is it diminishes brain function. Now, I don't know about you, but I cannot afford to have diminished brain function, okay? I need my brain. I need all of my brain. I need all those cells that I'm not even using because I just need all of my cells. And so when we're doing PPIs, we are diminishing our brain function. Some of the most startling chronic health problems correlated with protein pump inhibitors are cognitive disorders. Now, I'll tell you what, that's one of my greatest fears. I know that's my mom's greatest fears. We've talked about this getting older and different things. We just don't want to lose our brain. I'll just be honest, as a young person, whenever, I was growing up in the 60s and 70s and sex, drugs, and rock and roll, I never really did that because I was really, really respectful of my brain. And I knew that if I, did drugs or whatever, that I could really impair my cognitive ability. So cognition, being able to use your brain effectively, is something that's really high on my list. And so when you're doing protein pump inhibitors, it works on the brain as well. It says, while it's not such a novel idea that food affects our mood, there isn't yet a wide consensus on food's impact on brain health. A study released in December 2015 was prompted by research showing that PPIs increase the brain burden of amyloid beta. Okay, these are plaques. Amyloid beta, this is when you have Alzheimer's disease. You've got tau proteins in the brain. That is because the synapses in the brain get all clogged up and they can't fire, and so you lose your cognitive ability. It says that the study released in December shows that PPI use increases amyloid beta plaques in the brain, okay? It is the main component found in the brains of Alzheimer patients. So if you're taking a PPI and you prize your brain, I hope you'll think twice about doing that on a long-term basis because we really don't want to have those amyloid plaques in the brain. PPIs are also known to create vitamin B12 deficiency, which is a second factor in Alzheimer's disease. So I'm just wondering, with the increase in Alzheimer's, the prevalence of Alzheimer's disease, is it because we have these protein pump inhibitors so readily available? We can get them over the counter with no prescription required. And people do that because they want to eat what they want to eat and don't want to suffer for it. I appreciate that. But I'm just telling you, there's another way to work with your gut so that you're able to eat the foods that are good for you and not have any kind of deleterious effect. So researchers divided 60 volunteers into 5 test groups and 1 control group. Each of the 5 test groups were given a different PPI, okay? All 6 groups participated in computerized neuropsychological testing at the beginning of the study and again 7 days after taking their PPI maximum daily dose, okay? So we've got 6 different drugs. The researchers admit that a larger study is desirable, but the evidence was clear. We found a statistically and clinically significant impairment in visual memory, attention, and executive function, and working and planning function. All PPIs had a similar negative impact on cognition. So this is really, really important, okay? Of the PPI studied, Prilosec had the most significant impact, meaning it was a 7 out of 7 on the test, okay? Nexium showed comparatively less compromise on the brain. It only had 3 out of the 7 markers on that, okay? Fueled by this kind of research, a larger study was conducted in 2016 that analyzed more than 73,000 participants aged 75 years or older and free of dementia. These patients received regular PPI medication and had significantly increased risk of incident dementia compared with the patients not receiving the PPI. Now, as we get older, we're going to have those senior moments. We're just going to. The busier you are, the more things in your brain. A friend of mine, we say that all of our files are full. We can't file anything else away in the brain. We don't want to have that impaired by taking a protein pump inhibitor. So these people, they found that they had a significant increase of incident dementia. And what that means is they had an increase of senior moments that they didn't have before, okay? Researchers made this shockingly forthright conclusion that, quote, the avoidance of PPI medication may prevent the development of dementia. Okay, this is a quote from this research project. I'm going to tell you again. The avoidance of PPI medication may prevent the development of dementia. And I don't know that anybody has developing dementia on your bucket list. I just don't know anybody that has that. The fifth reason we don't want to take PPI is increase risk of death, okay? It is clear from the evidence as well as common sense that PPIs have a systemic effect on the entire bodies. PPIs launch an attack on basic cellular functioning, inhibiting healthy cellular metabolism from taking place. So what happens if you don't have healthy cellular metabolism? You get over into a disease state. That's what my whole life is about, okay? My whole thing is that we get you in here, we find out what's not working properly, and then we move forward to get you working properly so that you can have a long, steady life. And so we want to do that for you, okay? Let me see what it says here. It says, while the body's ability to convert the building blocks of life, namely proteins, carbohydrates, fats, and nucleic acids into usable fuel is compromised, so is our immune system, and life begins shutting down. A study, okay, that helped pioneer the awareness of harm due to PPIs is a 2013 study called The Inhibition of Liposomal Enzyme Activities by Protein Pump Inhibitors. Y'all can Google that, okay? Lysosomes are essentially tiny membranes or sacs that carry enzymes essential to cellular metabolic functions. When PPIs inhibit this function, there is an increased incidence of tumors, okay, and infectious disease. So there's a lot more in this article, but I hope I've given you enough information that if you are on protein pump inhibitors, you're going to have a second thought and do something else. One of the first things that we do if we're over 30, and I know 30 is not that old, but we have such a poor diet here in America. Let me put that another way. We have so many convenience foods. We have so many fast foods. We have so many prepackaged foods. Everybody's on the go, and so we tend to choose these things, especially when we're young. We are born with only a certain amount of enzymes in our pancreas, and when we use them up, we don't have any digestive enzymes. So everybody over the age of 30 needs to take a good digestive enzyme with every meal. This one is my absolute favorite. It's got a lot of fennel in it, and when I smell it, I love fennel, and my whole body just goes, oh, I crave that. But this is one that I take. It's a very, very good broad-based enzyme formula, and it helps me with all the different enzymes that I need because why? I'm over 30. I don't yet have any kind of esophageal reflux or anything like that, but if I did, I would take one of these products that increase the hydrochloric acid in my stomach. That's one of the age-related things that happens when you get older. You just naturally produce less and less hydrochloric acid. Sometimes I think older people are not hungry because they don't have hydrochloric acid in their stomach, and so their food just sits on their gut, and it just sits there, and it's heavy, and it doesn't dissolve and move through the system, and so that's why they're not hungry anymore. So I think everybody needs to address their digestive complaints with a good digestive enzyme. And then if you're over 50 and you have GERD, gastroesophageal reflux disease, then you're going to want to try one of these hydrochloric acid products to see if that just puts your biochemistry right, because we don't want you going into cognitive decline, you having a cardiac event, and we don't want you to have death. So hopefully these are some things that you can look at, you can use, you can share with your family, and you can have a better life. It's the weekend. I hope you have a great, great weekend. Christmas is just around the corner, so I know there's shopping and decorating and wrapping and all that kind of thing. Make sure to take time to be good to yourself, and I will see you next week. Take care. Bye-bye.